Right?
Dr. Hakigat, can you hear me?
I can hear you. Can you hear me?
I can faintly hear you.
Oh, is that better?
Let me take a look on our end here. Just a moment.
Testing, testing. I would sing, but I'm not super good at it.
Hold on. Okay, let's try this one more time. Dr. Hakigat, are you there?
Testing, testing. Can you hear me?
Very low. Yeah, very low.
Yeah,
Hold on.
I'm doing a normal voice. I can raise my voice if it's better.
Can we give one more time, Dr. Hakigat? I'm trying to get this corrected here.
Testing, testing. Can you hear me?
There you are, loud and clear. Thank you.
Okay.
Hello, Dr. Beam. Can you hear me on your end?
I can hear you. Can you hear me?
Loud and clear. Thank you.
Thank you.
Welcome, welcome. I apologize for the short delay. We had a few technical difficulties, but good evening. Welcome, everybody, both in person and watching via YouTube live stream. I'd like to call our board meeting for July 14th to order at 6:17 p.m. Please note, one or more board members may participate by telephone, video, or internet conferencing. Let us begin with our tribute. In partnership with tribes who called Phoenix their home first, we acknowledge and respect the land our schools are built on. We commit to being a strong partner with any and all tribal nations who entrust their children to our schools. We are grateful and honored to be partners. Miss Miriam, may we please have a roll call for attendance?
Carmen Trujillo,
Here.
Jessica Bueno,
Here.
Reggie Carrillo,
Here.
Alicia Vink,
Here.
Laura Diaz.
With that, we do have four board members here, and with a quorum, we're able to move on. Mr. Quintana, will you please lead us in the Pledge of Allegiance today?
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, let's see. With that, we can move on to our adoption of the agenda. Do any board members have any requests to move items on our agenda this evening? I don't either. Dr. Davila Hagigat, do you have any recommendations for our agenda this evening?
I do. Thank you, President Trujillo. Item E5 under consent agenda, we have a correction for the title as it was posted incorrectly. It originally said job description for peer lead, and it should be P-3 literacy coach. This correction should also be noted in the cover page when one first clicks on the agenda item. In addition, the document that was attached to this agenda item should list Bethune, Dunbar, Edison, and Emerson as the eligible schools. Capitals should not be included as part of the eligible schools. So we request that the consent agenda be adopted with the just mentioned corrections.
Thank you very much for that. Do we have a motion to approve the agenda as adjusted?
Jessica Bueno, so moved.
Reggie Carrillo, I second.
Thank you very much. Any discussion? Hearing none, may we please have a roll call vote to approve our agenda as adjusted this evening?
Carmen Trujillo,
Aye.
Jessica Bueno,
Yes.
Reggie Carrillo,
Yes.
Alicia Vink,
Yes.
Thank you very much. With that, our motion passes. And we will move on to our awards, recognition, and announcements, which I'm super excited about. Let's see. The board would like to welcome our new employee and the district's new superintendent, Dr. Ibi Davila Hagigat. Dr. Hagigat has served students in 3 states and 5 large school districts. She led school improvement in her role as a principal, assistant principal, and teacher leader. Most recently, she was the assistant superintendent for elementary education in Scottsdale Unified School District. She attributes her success to the strong relationships she builds, along with her ability to empower, motivate, and inspire others. We are thrilled to welcome Dr. Hagigat to Phoenix #1, and we know she is equally excited to meet our staff, students, families, and community. And I definitely second that. I have seen her abilities to empower, motivate, and inspire others, and I'm really glad she's here. So we go over and
Emerson School Camp through the AZ On Track Summer Program was a huge success. A total of 56 campers attended the program from both in-district and out-of-district schools. Campers participated in unique experiences, including playworks, swimming lessons, design and illustration, desert design, sticks engineering, Phoenix Youth Circus Arts, Media Arts, Gardening, and Murals and Math. As a result of the camp, 3 new partnerships were developed between Emerson and G Road, City of Phoenix, and Styx. And students painted a new mural in Emerson's courtyard. Overall, campers rated their camp experience on an average of 4.8 out of 5 stars, and a number of families who attended inquired about enrolling their children at Emerson. A special thanks is extended to the hard work and dedication of staff, camp counselors, our business partners, and students and families for making this camp a success. Thank you.
Phoenix #1 and Dr. Victor Diaz, Director of Human Resources, along with our partners at Maricopa County School Superintendent's Office, were featured in an article for Education Week on June 22nd. The article highlighted our district's work in the area of using stay interviews to drive teacher retention and the success we have found in how stay interviews impact strategic retention.
For our 4th one, the district launched our newly redesigned district and school websites. You can visit our new site at www.phxschools.org. For those who might have bookmarked our website, which I did and I had to adjust, we do need you to update that bookmark to reestablish connection to the new site. A special thanks is extended to Ian LaRue, our website specialist in our marketing communications department, for all his efforts in recreating this new beautiful site. We hope our families and community find the site useful and enjoy navigating the new look. Thank you guys very much.
Be on the lookout for the summer edition of our Inside Phoenix #1 newsletter. The newsletter is distributed to all homes and businesses within the district's boundaries and should arrive in mailboxes the 3rd week of July. We hope this newsletter provides important back-to-school information and highlights district happenings.
I'm excited. I like when those show up. All right, let's see. I guess we'll move on to our superintendent's report. Dr. Davila Hagikat, are you ready? I see Dr. Diaz. Hi, Dr. Diaz.
Hi, yes, I am ready. President Trujillo, Vice President Bueno, members of the board and cabinet. I am just so proud to have been selected as the superintendent for Phoenix L. The welcoming has been warm, has been genuine, and I am just very, very happy that I get to meet people on a daily basis that are making a difference for our students. So I want to thank you again for the selection. And I also want to thank you for giving us the opportunity for myself and my team to really take Phoenix L to whole new heights. We're eager to start the year. I am looking forward on August 2nd to have the opportunity to meet all of our staff and for you to be a part of our back to school celebration. And I really am interested in making connections with our students, with our families, with our staff, and with our community, because I know that that will be the way that we will be able to really shape a future that includes our students in really being able to take advantage of everything that we offer within our district. I want our parents to know that all of the adults are working very, very hard to bring the absolute best to every single child, and making that connection is going to be key. We want to make connections to feel connected. Another area that I wanted to share, and you will hear later tonight about COVID-19 levels from Ms. Linda Jeffries, and you're also going to see that we have seen community levels drop in the 7 zip codes in which our schools reside. And so that is great news. And we want to thank our community for taking precautions to help prevent the spread of COVID-19. That is hot off the press. We get that information on Mondays. And so I was eager to share as part of this report because we want to be responsive to the minute by minute information that we get. So again, I thank you for this opportunity, and I look forward to continuing our relationship so that we can make this Phoenix Elementary go into whole new heights. Thank you again.
All right, any comments or questions? Thank you very much, Dr. Hagigat. If I could just ask a quick question for clarification, would you please let us all know how to pronounce your name and what you prefer for us to call you?
Yes, Dr. Davila Hagigat, and the Hagigat, it starts with the Ha, and then Gi as in guitar, and then Gat as in you got it. So you can call me Dr. Ibi Hagigat, you can call me Dr. Davila Hagigat, you can call me Dr. Hagigat. I am responding to all of it because, again, in the spirit of connections, I want people to be able to connect with my background, and that's why Davila is so important to me.
Thank you very much for sharing. You articulated so much better than I could have, but I appreciate it. And the feeling is mutual. We all want to make sure we're being respectful and say it correctly, the right way, so that way we learn as well. So thank you very much. Moving on to item C1, board reports. I would like to share that currently I'm working on structuring the officer roles for our board and school governance. So that's a project I'm hoping to finish by December and hopefully bring to the board, so that way we have new onboarding resources for the coming year. We also got to participate in a conference last month in Chicago, and it was a real treat to travel with board members, Mr. Carrillo and Vice President Ms. Bueno, to experience, a lot of those conversations that, of course, we probably don't have too much time to research during the week, but it was a great trip. We got to also visit remind me of the name, it was like a National Museum of Mexican Art. I can't remember the pretty beautiful name, but that was a real treat because it looked small from the outside, but there was a whole plethora of different types of art stuff I'd forgotten about. And it's really great to kind of be reminded of those things, to bring them home and then definitely keep them in mind for serving the board and the district. So that's all I have to share.
Thank you, President Trujillo. Yeah, I would like to share just again to our families how excited we are for this new school year. I know staff is really excited to see all the students August 3rd. And I just want to reiterate how passionate, the leadership of this district is in welcoming of our families and community members and students. So I'm just really excited to get this school year started. And I also had the pleasure of meeting our new principal over at Capitol, Ms. Botts. So it was great to meet her and CJ for the IES, which was great. And I know we're gonna miss Principal Dirk. He's in the audience with us today, but I just wanted to, let the Capitol families know that we have a really good vision for Capitol, and just knowing that the kids are going to be safe, and with Ms. Botts's leadership, we'll continue to succeed. So thank you.
I provided a lot of updates last board meeting about the AZ on track, and we covered it here. That's great. I do want to see if we have a recording of the play. If not, I'm out of luck. But just to follow up on Board President Trujillo's comment about Naleo, we got to go to Naleo, and it was a wonderful experience for us, especially to be able to connect with public officials across the spectrum, from board members, from legislators, from congressmen and women. And we even got to hear Vice President Kamala Harris speak to us about the impact we're having in terms of what title and role that we represent. It was especially it was a learning experience for us too. We got to attend many sessions talking about Easter funding all the way from development. Naleo specifically focused on issues that are impacting the Latino community and supporting elected Latino officials. They support everyone elected and that is a member of the program, but those are the issues they place emphasis on, and that's relevant for us and impactful for us, since a huge demographic of our population is of the Latinx community. And so we're appreciative that we got to be able to go. Appreciative to, again, everyone who coordinated that logistically, the travel, the hotel stay, for us to be able to attend these conferences. And I want the public to know that we are very intentional about these conferences that we go to. We're new members and we want to make sure that we're going to ones that are very impactful to us, since we didn't get to go to them that first year, and to be able to, again, be intentional with the preceding years to know which ones are beneficial, which ones are not. So again, thank you. Another board report is just a reminder about vaccine. As board Vice President Bueno mentioned, schools is opening up back soon. It's coming fast, right? Parents are already getting here, buying uniforms, whatever they have to buy. But we're also hosting vaccine drives. You can go to our social media, Phoenix Schools, and you can on Facebook or Instagram. I don't think we're on Twitter, but if we are, it's probably there. But that information is posted on Twitter. So again, with the situation, we have our mitigation plan that you can turn to, our COVID protocol chart that I'm grateful to Dr. Davila Hagigat for sharing to us, but a reminder that COVID cases are high, and just again, check on your status. If you have not got vaccinated or have had your child vaccinated, share this information with them so that they know that there's a space for them to go, so their child is safe when they enroll in school in August. But that's it. And then thank you everyone for coordinating that.
Do we have any other board reports? All right, with that, we can move on to our community communications, item D1. At this time, the board will hear comments from members of the public who have submitted requests to address the board. Each speaker, well, actually, do we have any comment cards this evening, Ms. Miriam?
We do not.
Okay, wonderful. Please structure your comment to take about 3 minutes. Just as a reminder, members of the board may not discuss items that are not specifically on our agenda. Therefore, any action needed as a result of a public comment will be limited to directing staff to study comment matters or rescheduling the matter for future consideration at a later date. With that, do we have any electronic ones?
We do not.
All right, perfect. Will we welcome our speaker up? Come on up. I don't have any cards in front of me, so I'm assuming Miss Miriam might have one.
We don't have anybody shown up for speaker or,
I thought you said we had one.
oh, no.
So none sounds
Sorry.
like one. My apologies. Well, that was a bit of a waste of time. Then let's move on to our approval of our consent agenda, please. The consent agenda lists several items for approval by the board in a single motion. The items listed under the consent agenda have gone through the superintendent's cabinet review and recommendation. Do we have a motion to approve our consent agenda as now presented?
Jessica Bueno, so moved.
Thank you. Do we have a second?
Roger Carrillo, second.
Thank you very much. Hearing no discussion, may we please have a roll call vote to approve our consent agenda? Miss Miriam.
Carmen Trujillo,
Aye.
Jessica Bueno,
Yes.
Reggie Carrillo,
Yes.
Alicia Vink,
Aye.
Eloy Diaz.
Aye.
Thank you. Thank you for that. With 5 in favor, the motion passes, and we will move on to item F with our wonderful Dr. Gonzalez. Good evening.
Good evening. I'm going to switch to a different microphone. Good evening, board members, President Trujillo, and our viewing audience. This evening, the item that we have for you is part of an ongoing study that we've been doing with ASU and a group called PlayWorks. It's a specific program that's designed to function in our preschool program. It's a research program, and we've been doing this work for some time. We're at the point where we are getting ready to apply for a grant with the federal government in investing in education. In order to be able to apply for that grant, we need to have approval to share data from the research with one another. And so the memorandum in front of you is requesting that we have permission to share data. And so let me share a little bit about the type of data that we would be looking at and what this program does for our early childhood educators. We're fortunate to have in the audience tonight both our principal from Faith North and two of the lead researchers and developers of the iPlay program. So if we have further questions, they're here to be able to answer them. But this program is designed to provide supports to early childhood educators in understanding how to work with the diverse needs of students, specifically looking at the ways in which we engage students through storytelling, play, and drama. And this is something that we're excited about because if we get this grant, we're going to be partners in helping to develop what that grant looks like and in the ways that we work specifically with some of our students with special needs, such as nonverbal students, students who have emotional trauma needs, but also students who have tactile or functional needs that are not best addressed in traditional modalities. So with that, I will open it up to our board members to, if they have any questions or if they would like to ask questions of our special guests.
I have seem pretty loud. I have questions. Just for, I don't know what this title means, but what does it mean, provider scientists for the agreement?
So in the
Okay.
agreement, the provider scientists, because our partners are researchers, they are the providers of the professional development, but they are also the scientists doing the research in the work that we're doing. And what we're specifically looking for is understanding how teaching teachers how to use different modalities with students with special needs brings out better learning outcomes for the students and a greater sense of belonging and connectedness.
And when did this research topic start?
We started in 2017. Do you want to come up and?
Okay.
There we go. Good evening. My name is Jenny Millinger. I'm the Associate Artistic Director at Child's Play Theater Company, who is the programmatic partner on this project. And yes, as a matter of fact, this particular study started in 2017, but we actually started working with your preschools back in 2012 when we initially started doing this project. So we have been partnering off and on with the district for a decade now in this work.
And you represent ASU?
Child's Play.
Child's Play, I'm sorry. Is there someone who represents ASU here?
Unfortunately, Dr. Marley, who's our principal investigator, is on a river raft in Idaho right now, and could not join us this evening. The reason we came forward to you this evening is because of the due date of the application, and unfortunately, he was unable to join us tonight. But I can do my best to answer his questions.
Oh, thank you. When is the due date for the application?
July 3rd, July 21st.
Okay, and I'm asking these questions, follow-up questions, because of our last research topic that was brought between us, between a collaboration with the ASU is, so I imagine that their IRB clearance and everything has been put forth.
Yes.
Are you able to provide that information to us?
We certainly can do. We have an IRB for the existing grant, and we would be applying for an IRB specifically for this section of the research upon funding of the application.
Okay, this makes me more optimistic. I'm just worried stepping into waters and research with ASU because last time, I do have questions on that, but I will follow up with the board date with that, but I know that that didn't lead to a grant. Do you know how much the grant amount is worth?
It is $4 million.
4 million? Okay, thank you.
And Board Member Carrillo and other board members, the grant surveying process would be in compliance with the recent legislation that was signed. So any of the data that we're asking, part of the International Review Board, helps to protect student confidentiality and teacher identities so that there's no information that is being shared that would not be, that would be traceable to students or families.
Okay, and then what is the time period for the grant in terms of how we? when we must spend that monies.
Yeah, absolutely. So it's our understanding that notification occurs this winter with a potential start date of January. It is a grant that goes to Arizona State University. They are the ones who are applying for it with us as project partners. We're looking for the district to sign on for the initial part of this project, and then we will be bringing on additional districts towards the end of the project as well. And we anticipate a 4-year timeframe starting in January.
So in terms of our capacity to support, what are our roles in terms of, I know that you are part of, you and Dr. Marley, are you going to be running the study in the school, or is that something that we need? And I'm asking because I don't particularly agree with putting this on our teachers or our staff because we don't have the capacity for that.
So the participation of your staff is primarily as recipients of professional development that supports their activities in the classroom. Additional activities related to the grant would primarily be with Diane Salazar and Angela Eddington, who have helped craft the idea for the grant and the need for the grant. And we will be working with them to think through the curriculum design for it. But the actual burden on teachers it's activities that happen in the classroom along with them. So we pair a classroom teacher with a teaching artist who co-teaches with them to help the classroom teacher learn new strategies.
And so with the grant that is being channeled, that ASU will receive that money, and then so the district's not necessarily receiving the 4 million?
Correct. It is a grant from ASU in which the district is partnering by providing us with the opportunity to work with your teachers and students.
And for Diane or anybody from our school, are they receiving any type of stipend? Are teachers who are responding to the survey receiving a stipend or anything like that?
Yeah. Go ahead.
So our teachers, in the past with our iPlay, the first grant that we started in 2018, when I came on board, teachers received a stipend for participation in the program. And the plan, remember, this is a grant that we're developing collaboratively with ASU. We haven't, identified those specific parameters for the professional development, but it is part of the planning that we would provide a stipend for teachers.
And we have the ability as well to provide a stipend for Diane and for Angie for their time.
Okay.
On the preference of the district.
Okay, thank you. I'll pause and leave space if anybody else has any other questions or concerns.
So I just want to, one thing I'd like to share with you is that we, all of my teachers, minus one teacher who had taken the training previously, participated in the 2018 to 2020. We got a little derailed at the end there with the data, but because of the pandemic, everyone that participated in that grant really took those strategies into their classrooms. They're using them. It's something that we're using every year. It's a very impactful set of strategies, especially with the teaching artists working side by side to present those lessons and to model with our teachers. What we're doing with this grant and what we hope to do is we want to develop something that really addresses the needs of our diverse learners. And that was something that we noted in the grant from the previous grant, that we have a unique group of students, and we want to make sure that this is appropriate for all students. And so that's the impetus for this new grant. The other thing that we want to incorporate with this grant is parental involvement and helping parents to understand their role and what they can do at home, and also potentially provide some workshops for parents as well. Anything you want to add?
And a significant amount of curriculum materials, books, puppets, supplies that will go and stay in all of your classrooms and go home with your families.
Ms. Salazar, is the parental involvement part new to the program, or is that? Okay.
Yes. And we met with ASU to discuss that, you know, ASU invited us to discuss with them and collaborate and what it could look like. And that was an aspect that we felt was much needed to bring our parents in, you know, just as we're working with our social emotional learning and bringing parents into that learning as well. We feel that it's really important that parents also have an opportunity to learn different things that they can do with their children at home that will impact their literacy and their learning and their social emotional development.
Will they be also part of the study, or is it just our students?
We haven't decided on that as yet, because we are working together to develop the grant itself. Right now, we just would like to get the approval to move forward so that we can apply for the grant. As Jenny said, that we're on a kind of a sharp deadline of the 21st of July. But that's something that we would like to consider.
So we are just approving the opportunity to apply for the grant?
Yeah. And the data sharing agreement.
Got it. All right. I don't have any further questions. Does anyone else?
Yeah, I just want to ask about the parent involvement and engagement that if possible, it's also provided in Spanish.
Yes.
Absolutely.
Mhm.
Absolutely.
Our plan is to provide every family activity in English and in Spanish, including books.
And same question for parents too involved. Are they going to receive stipend or some type of incentive for this?
If there is a research element, they would definitely receive a stipend. All families who participate will receive books and multimodal sensory items to take home with them. So they would essentially be coming to like a book reading, like you would do at a library, but they would be learning strategies along with their kids and be able to take home learning materials with them in either English or Spanish after every event.
Okay, thank you. And then, I'm sorry, I didn't know. I do like that the co-planning with Phoenix and ASU. I do like that component. Additionally, in terms of when I work with researchers, we only bring them on when there's co-planning with the researchers and whoever the community is that they're impacting, not necessarily this district. And so for this grant, I would like to see some type of component in there where if it's at the workshop where it is passing on those research skills and traits to parents, regardless of what the capacity of the research is, it's teaching those skills. And whoever I work with, that's what I make sure that they're passing on those research skills, or at least teaching parents and the community about what research is, those research components. And so that's something that I urge, because for too long, researchers come into our community and especially higher institutions to brain drain, to pick and prod and see what information they could collect and how it's going to benefit them. But I do see a huge benefit with us with what we're saving here. However, I do want to mention that because I do have, this is just putting on a radar follow-up board date based on the last research collaboration we had with ASU. And that's not something that you're probably aware of, but I'm just speaking to our leaders, our cabinet leaders here. But I'll follow up with that later.
I appreciate your feedback.
All right, hearing no further discussion. Thank you guys very much for the
Thank you.
extra
Thank you.
information and the impromptu Q&A. Hearing no other discussion, do we have a motion to approve our research agreement between Faith North and ASU to conduct research on the effectiveness of early years educators at play professional development?
Reggie Carrillo, I motion.
Jessica Bueno, second.
Thank you. Any discussion? Hearing none, may we please have a roll call vote to approve our agreement?
Carmen Trujillo,
Aye.
Jessica Bueno,
Aye.
Reggie Carrillo,
Aye.
Alicia Vink,
Aye.
Laura Diaz.
Aye. Thank you very much. With 5 ayes, the motion passes and we can move on to our next item. It looks like the document I printed looks like another item, but I think we're moving on to item G1 with Mr. Quintana. Thank you guys very much. We're glad to partner up. Have a great rest of your evening. Sorry, Mr. Quintana, we are ready when you are. Well, good evening, President Trujillo, members of the governing board. Tonight, it brings me great pleasure to provide the district's COVID dashboard report to the board, as well as some discussion and potential recommended changes to our current mitigation plan. And so I'd like to start the presentation by sharing a bit of information on how the CDC and the Maricopa County Department of Public Health is currently reporting the new COVID cases. So if you were to look on the CDC's website or the county's website, the CDC is currently measuring the COVID-19 by what they're calling community levels. And those community levels are low, medium, and high. And the way that the CDC determines the community level and their prevention mitigations based off of the latest data are determined by looking at the number of hospital beds being used, the hospital admissions, and the number of COVID cases in an area. So as you can see on this chart, if you're looking at the left-hand column, you can see that that is where they're reporting the new COVID cases per 100,000 people in the past 7 days. So the first row would be fewer than 200 cases, and then the second gray shaded row would be more than 200 cases. And then the next column would show the new admissions per 100,000 people, and then the percent of staffed inpatient beds for the last 7 days. So if you look at the low column, if we had fewer than 200 cases per 100,000 people, and we had less than 10 admissions, hospital admissions, and less than 10% of the staffed inpatient beds occupied by COVID-19 patients, then we would be considered in the low level. And then you can see the data for the medium. If our admission, the hospital admissions were between 10 and 19.9, if the percent of staffed inpatient beds occupied by COVID-19 patients were between 10 and 14.9%. And then you see in the medium level that the percentages or the figures for individuals or 200, more than 200 individuals per 100,000 people is greater than 10, and then the inpatient beds is greater than 10%. So that would be the medium level, and then you can see the same percentages and figures for the high level. So the CDC is currently recommending the following mitigation strategies for each of the community levels. So if you were to look at the low community level, their recommendations is that individuals stay up to date with their COVID-19 vaccinations and that they get tested if they have symptoms. In the medium level, community level, really, the only difference is for individuals who are at high risk of severe illness. And so there are some additional precautions that they would certainly want to talk with their health providers in possibly wearing masks and taking other precautions. And then, of course, you can see those same strategies that were in the low level, staying up to date with the COVID-19 vaccines, and then also getting tested if someone were to have symptoms. The real changes that we see is in the high community level. And so when an area is at high COVID-19 community level, universal indoor masking in public and in schools is recommended. And again, individuals would stay up to date on their vaccinations, and then testing is the same. And then, of course, additional precautions for those individuals who are in the high risk categories. So now I wanted to take the opportunity to show how the county is now reporting the community level on their data dashboard. And so you can see this screenshot. We're able to pull up Phoenix Elementary School District. Now I wanted to remind you or to share with you that this data that we're currently seeing was as of July 6th when this presentation was uploaded for the board's review. So on July 6th, Phoenix Elementary School District was at a high community level. Now, you'll also notice that when we go in this view, that we can see cases per 100,000 people and percent positivity within the community. The percent positivity is not one of the new 3 recommended areas that determines the community level. However, the county is still using this data just for information only. So I wanted to be able to provide that to the board because you will see it if you were looking at the community dashboard. And so we also wanted to provide you with information on what that community level currently looks like for each of the 7 zip codes in which our schools reside. So again, this data was taken on July 6th. And I'm sorry, I should have mentioned on the last slide, Dr. Hagigat had mentioned that our current, let me go back to this. So on July 6th, we were at high, but looking today, our current level has decreased and now the district is in a medium community level. So that's great news for our schools in our community and our families living within our community. So let's go back to the 7 zip codes in which our schools reside. Again, this data was on July 6th. And so at that time, 6 of our 7 zip codes were in the high level, and we had 1 that was in the medium level. We're pleased to report that as of this week, all of these have decreased, and they are either in the medium or even the low level. And so as we're looking at reporting this data using this new community level tool, we are recommending that we begin the school using the district's COVID-19 community level as our guide to mitigation prevention. However, we want to review and consider working with our school administrators and our safety team to monitor the impact of COVID-19 on a site-by-site basis so that we can differentiate mitigation plans based on the individual school's COVID-19 community levels. And so I wanted to touch a little bit on the CDC's recommendation for quarantine and isolation. And so the CDC says that for individuals who are exposed to COVID-19, that they should quarantine, stay away from others when an individual has been in close contact with someone with COVID-19. And for those who are sick or who test positive, the CDC recommends that you isolate even if you don't have symptoms. So I wanted to share the CDC's recommendations for quarantine and then show you Phoenix #1's recommendations that is currently in our mitigation plan. So if you or if an individual was exposed to COVID-19 and they are not up to date on the COVID-19 vaccinations, then the CDC recommends that those individuals quarantine for at least 5 days at home and that they get tested at least 5 days after their last close contact with someone with COVID-19. And then the district's mitigation plan says that individuals who were exposed and are not up to date with their vaccinations stay home and quarantine for 10 days. So you can see the difference. CDC is saying 5 and the district is at 10 calendar days. Or individuals stay home and test after day 5. And if they test negative, then they can return after day 7. Now, I want to just share a little bit of information because you might recall when we first started using our mitigation plan, we had the conversation and we heard conversations around fully vaccinated. If you notice now the language that the CDC is using, they are saying up to date. So I wanted to just distinguish the difference between those two. So initially, fully vaccinated meant 2 weeks after the primary dose. So for example, if for those individuals who had the Pfizer or the Moderna vaccinations, the initial primary dose was 2 doses. So an individual was considered fully vaccinated after those 2 doses. And then the boosters came out. So now individuals for both who have had the Pfizer or the Moderna vaccinations, there are 2 boosters. And I'm sorry, let me preface this. This is for adults, so age over 18. Of course, this is going to differ depending on the age category of individuals. So I'm just giving an example for adults. So we have the 2 primary doses, which was considered fully vaccinated. And now for those individuals who get the 2 boosters, the CDC is now saying that you are up to date immediately after you have both of your boosters. So I think that that's important for us to understand the language fully vaccinated versus up to date. For those individuals who had the Johnson & Johnson vaccination, 1 dose was considered fully vaccinated. So a person was fully vaccinated 2 weeks after their 1 dose of Johnson & Johnson. And then, of course, they're recommending 2 boosters, either the Moderna or the Pfizer. So an individual who had the Johnson & Johnson vaccination would be considered up to date after their 2 doses. So our next slide is for individuals who were exposed to COVID-19 and are up to date on COVID-19 vaccinations, or if they've had COVID-19 in the last 90 days. So for those individuals, according to the CDC recommendations, if those individuals have no symptoms, then no quarantine is necessary. They're recommended that they watch the symptoms for 10 days after their last close contact. If individuals have symptoms, then it's recommended that they stay home and get tested, continue to stay at home until they know the results of the tests, and then of course wear a well-fitted mask for 10 days anytime that you're around other people. And then getting tested at least 5 days after you last had contact with someone with COVID-19. In the district's mitigation plan, we break it out by no symptoms and symptoms. So for those individuals who have no symptoms, who were exposed, who are up to date with their vaccinations, or who had COVID-19 in the last 90 days, no quarantine is necessary. For those individuals who have symptoms, they stay home and get tested after 5 days. If that test is positive, they isolate for 10 calendar days after the symptoms began. They remain home until symptoms have improved, and that there's no fever for at least 24 hours without the use of fever-reducing medication, and of course that they wear a mask around others for 10 days. If they have a negative result, then they return when symptoms have improved. So this next slide is for the individuals who tested positive for COVID-19 or have symptoms regardless of vaccination status. So the CDC recommends that those individuals stay home for at least 5 days and isolate from others in the home, wear a well-fitted mask around others. And so the difference here is the ending of isolation. So if the individual had symptoms, then they would end isolation after 5 full days. If they are fever-free for 24 hours without the use of fever-reducing medication and if symptoms have improved. And then for those individuals who did not have symptoms, they would end isolation after at least 5 full days after the positive test. And then looking at the district's recommendations for those individuals who have symptoms, they isolate for 10 calendar days versus the 5 days that the CDC recommends. They remain at home until symptoms have improved for at least 24 hours without the use of fever-reducing medications. They wear a mask around other individuals. For those people without symptoms, they isolate for 10 calendar days after a positive test. They again remain home until symptoms have improved and no fever for 24 hours without the use of fever-reducing medication and wearing a mask for those 10 days while around others. So I wanted to update you on where we are with our current mitigation plan. So we are currently working with Healthy Verify. They are rewriting our mitigation plan in accordance with the CDC guidelines and recommendations. We are expected to have that plan sometime next week. The plan will include recommendations for the community level measurements that we just shared with you tonight, and distinctions will be made on the low, the medium, and the high community level. Again, Phoenix #1 will begin the school year using the district's COVID-19 community level as our guide to mitigation prevention. However, we want to work with our school administrators and the safety team to possibly monitor the COVID-19 impact on a site-by-site basis so that we can differentiate the mitigation plans based on an individual school's community level. So a draft will be presented to the district next week. We'll share that draft with our safety committee for their review and input. We are hoping to bring that to the board next Thursday at our board meeting so that the board has an opportunity to see the recommendations from Healthy Verify. Once we review it, then the final draft will go to Dr. Moran with Healthy Verify for medical review and any possible edits, and then her approval of the mitigation plan. And so now I'd like to share possible potential recommendations that we might see based on the community levels and prevention strategies. So, for example, we might see in our new plan, if we are in the low community level, that we would recommend individuals stay up to date on the COVID-19 vaccinations, get tested if they have symptoms, and then maintain improved ventilation throughout indoor spaces whenever possible. These are also prevention strategies that you'll find on the CDC's websites under the school guidance section. If we were in the medium community level, again, this really impacts those individuals who are higher at risk for severe illness. So they would work with their individual healthcare providers and take the necessary precautions that are provided through their physicians. They would stay up to date with vaccinations, get tested if they have symptoms, and then of course the ventilation. Now, possible consideration could be screening testing. And with screening testing, the district would continue the practice of providing the COVID tests to students and families who have symptoms or who were exposed to COVID-19 while our supplies last. And then if we look at the high community level, we might see the recommendation for universal indoor masking in public and in schools is recommended. Again, stay up to date with the COVID vaccinations, get tested if you have symptoms, maintain improved ventilation, and then of course, additional precautions may be needed for those individuals with high risk and severe illness. And of course, that would be shared by their own healthcare providers. So another area of consideration that we could possibly be looking at would be reviewing the circumstances and consider prevention strategies like screening testing, possible cohorting, contact tracing, increased ventilation in our schools where possible, including our buses, and also possibly temporarily considering stopping high-risk activities like close contact sports, indoor band, choir, those other activities that have an increased potential of exhaling. And so with that, that concludes my presentation on how we plan to look at the community levels of COVID within our community and what we might see in future reporting. And at this time, I'd be glad to answer any of your questions.
Thank you, Ms. Jeffries, for the clarification update on the mitigation plan. Is this something that we can, especially before our parents go back to school, put on our social media sites or maybe on our website? This is great information and it's brief. still a little confusing. Not that you presented confusing, definitely not, but just the guidelines with CDC, and it's something that everyone's generally confused about. But
Absolutely.
I asked if we can present it on our website, just so our families, our community can look it up, just so they can understand what our update ours, especially. Even if we just focus on our guidelines specifically, I would be fine with that.
Absolutely. This information will definitely go onto the website. Once we get our new mitigation plan approved, get the input from Healthy Verify. As I presented this new model of how we would recommend reporting the new data, what we would do is then create tables and content that would mirror this presentation. Currently, if you were to go on the site, we are currently posting the mitigation levels on our old format, but we will definitely update that to reflect the current practice as well as the recommendations from Healthy Verify. So, and it is also our plan to be able to have a mitigation plan in place so that we can communicate this to families before school begins.
Thank you.
You're welcome.
I just want to ask, the screen testing is not the pool testing, correct?
That is correct. We certainly would want to work with our nurses and our healthcare providers, but as we understand and looking at the CDC recommendations, it is providing some sort of a screening, which would be considered the COVID test that we provide in our schools for those individuals who either are exposed or have symptoms.
Listen, so real quick, does that mean tests are like done in our nurse's office as opposed to sending them home? What does the test that we provide look like?
So our current practice is to provide the families with the tests and then to have the families test at home.
Okay. And then do they report back to us at all, or?
Yes. So after they take their test, then if they're positive, the parents then call the nurse's office and report the positive case. If they're negative, then we look at our mitigation strategy, follow that strategy for employees as well as students. And so families work very, very closely, or I should say our school nurses and our principals work very, very closely with those families and students who are exposed or possibly have symptoms or test positive for COVID-19.
Madam Chair, I have just a couple of questions and thoughts. Ms. Jeffrey, I absolutely appreciate you putting together this presentation and presenting tonight. I do wish I had reviewed it just a tad closer prior to this evening, though. And I think I have asked for this before, but when we put something like the CDC guidelines and our current plan side by side, I really need us to quote the CDC guidelines directly from whatever site we are using, and then reference that site somewhere in the presentation. Because again, I'm looking here at the CDC guidelines directly from the CDC website, and it says to wear a well-fitting mask for 10 full days, and do not go places where you're unable to wear a mask in pretty much all of these scenarios. And I don't see that throughout the presentation. I see it in a couple of areas for the CDC isolation guidelines, but not all of them. So I just want to ensure that we really are looking very closely at what the CDC has published and that we are quoting it so that our parents, our board members, anyone can go directly to that source that we're using and see that exact wording as well.
Thank you, Dr. Fink, for your comments.
Okay, thank you. And then just, and not directly to you, Ms. Jeffries, but as an overall, as we move forward with having Healthy Verify revise the plan, I definitely want to be able to hear from Dr. Moran and maybe even a representative from our health department at this point. And I'm hoping that someone with a medical background can discuss the effectiveness of masks, given the time that our students will have their masks removed for meals, because we do have indoor cafeterias because of our heat, and we're eating breakfast in the classroom. And the types of masks that our students are wearing, because we know that all of our students are not going to be wearing N95 masks, or maybe they are. I mean, that's a question I have. And the contagiousness of this virus and our current variants. So just something I would like to hear from health professionals regarding as we discuss like how we move forward.
Thank you, Dr. Fink.
I think that is all that I have. Thank you.
Thank you all very much. Ms. Jeffries, for my own memory retention, can you touch on the difference in, I guess, the need to get a booster at a certain adult age? Like, which boosters am I at 43 supposed to have? It says adult, but I'm not too sure, like, do I fit into, because I know, you know, my mom's is going to be different than mine. But maybe it's not. So I want to know if
I
you've
have
got
the
that.
exact verbiage on my laptop.
Okay.
If I can just get my laptop.
Oh, I'm sorry to bother you with it. I thought you might just know offhand.
I have that tab opened. If you just give me just a moment, we can talk about that.
Everything changes, and I know we have our young students able to now get their vaccines. So yeah, touching on the example of the adult, I thought to myself,
Sure.
darn, am I supposed to go get another
Sure.
booster?
Okay, so so I'm looking at the CDC's website under vaccination, staying up to date. So for adults ages 18 years and older, if you had the Pfizer vaccine, you had 2 primary doses that were given 3 to 8 weeks apart. You were considered fully vaccinated after that second primary dose. Then you're eligible for a booster for both Pfizer or Moderna. And they're saying for most people, at least 5 months after the final dose in the primary series. And then the second booster is at least 4 months after the first booster. If you had all of those vaccinations, including the 2 boosters, you would be considered up to date with your vaccinations.
All right.
Now, there's also, I've got children ages 12 to 17, and then also children under 11. And so it's very, very specific for the age categories. So I would encourage families, if they are looking to see if they're eligible, number one, primarily talk with your doctor first, because your doctor will be able to better guide you. But there is information based on those age categories on the CDC website under vaccinations.
Perfect. Thank you for the clarification.
You're welcome.
Really helpful. Do we have any other questions? All right. What is our recommended action for this? If it's coming next week, we're just hearing about, okay.
Yes, tonight was just a receive and discuss, and we look forward to bringing the new revised mitigation plan from Healthy Verify, hopefully next week. As I mentioned, we are expecting to have that draft to us early next week, and we'll review with the safety committee. So it is our intent to have another update for the board next Thursday Is that the 21st of July?
Yes.
Yes.
Do we expect Dr. Moran to participate?
We have
Oh.
requested that Dr. Moran and Mr. Hill, if you remember Eric Hill, to attend next week. We are still waiting to hear if Dr. Moran is available. Mr. Hill is definitely available and will plan to be here.
Got it. An update before Thursday would be helpful if, even if we have somebody replace Dr. Moran, would be helpful to know. I'll be wondering at least
Okay.
until. But other than that, hearing no other questions, I think we can move on, and we're really
Okay.
appreciative of all the information. Thank you very much, Ms.
You are
Luna.
most
I
welcome.
appreciate
Thank
it.
you.
All right. Mr. Quintana, who will be discussing our proposed budget this evening?
Yes, thank you, Madam President. This evening, we would like to recommend the administration to have the board adopt the proposed budget for this next fiscal year. If you recall, at the June 30th board meeting, we had a presentation by Mr. Damon Norris about the budget and all the information that was submitted to the state ADE. And that evening, the board approved the proposed budget for the new fiscal year. This evening, we're asking for the board to adopt that same budget. There's no changes, everything's to the penny what it was. The only difference is that by approving the proposed budget, we want to give the public at least 10 days to be able to review it, to react to it, in case there's any questions about that. And so at this point, it's been past the 10 days. And so we're able to recommend the adoption of this budget for the board. So we're asking for the board to approve the adopted budget this evening.
Thank you very much. With that, I guess we will move, I'm sorry, we will need a motion.
I just have one question. After those 10 days, we're going to submit the budget to the state?
What happens is when the proposed budget is approved, which was on the 30th, we submit that right away to the state. So that's already been submitted.
Mhm.
And then now after those 10 days and when the board approves the proposed budget, we will resubmit again to the state. So, so we submit twice. And we did it already on June 30th or the day after. And then we're going to do it again after this evening or this tomorrow. We'll resubmit the same budget again.
Okay, thank you. If there's no questions, I'll motion to approve the proposed 2022-2023 budget.
Thank you. Do we have a second?
Roger Carrillo, I second.
Thank you. May I please have a roll call vote, Ms. Miriam, to vote on this matter?
Carmen Trujillo,
Aye.
Jessica Bueno,
Aye.
Reggie Carrillo,
Aye.
Alicia Vink,
Aye.
Eloy Diaz.
Aye.
Thank you. With all 5 in favor, our motion passes. Thank you all very much. And with that, we can move on to the next item. Let's see. Item H1. Dr. Davila Hagigat, may I ask you to kind of give us an intro into our next item? We are going to discuss the cool opportunity to update our board meeting dates to a different day of the week. So I thought maybe you might be able to articulate the matter better than I could, so that way we can open for discussion and get this decided.
Absolutely. Thank you. Can you hear me okay, President Trujillo?
Yes, ma'am.
Thank you. The interest here is very, very simple. We are looking for either Tuesday or Wednesday as our days for our board meetings. And part of the interest, initially, as we discussed this, we thought that Wednesday may be ideal as there are less holidays or less interruptions in general. It's also the day where our teachers and our schools have early release. So it gives us the opportunity to really visit our schools and have things really fresh in our mind so that we can report and highlight all the wonderful things that are going at each school. I know that in having individual conversations that Tuesday was also something that was of interest, just based on schedules and personal commitments as well. And so tonight I bring up and propose that we look at either Tuesday or Wednesday as our new dates. And I'd be more than happy to hear other rationale around this interest.
Wonderful. Thank you very much. And we'll just kind of open it up for discussion on this. If anybody would like to start, thank you.
I think firsthand, my preference is Tuesday, just because I feel that Wednesday can be overwhelming for parents because it's a half day and it might be a little bit more difficult to want to come and attend a meeting. I know we stream them, but I think if, that's Thursday, we keep the same idea. And I think Tuesday just might be an easier transition. So that's just kind of my thoughts, but I'm open to hearing what anybody else has to comment.
I also like Tuesdays. Again, I would also like to hear what admin cabinet members think, because they're the ones who are working those days too. Tuesdays, because of the same reason Vice President Bueno mentioned. I'm wondering if we do it Tuesday, can we also do it an hour earlier? Because I know that our meetings especially can go late. And so I want to be respectful of the staff that does have to stay on until forever long our meetings. So if we can do them earlier, I appreciate that too. For Tuesday, I'm not in favor of Wednesday. I think it's a great idea. It's just for Wednesday, I just want to know what admin thinks, because it's a half day for everyone, and I'm not too sure what you all do when it's half day. If you're still here till no more hours, or if you two want to utilize that time that you're given instead of going to a board meeting on that day. I also think for staff, it might be more ideal to go to a meeting on Tuesday if they plan to go in and knowing that they have a half day the next day. I prefer Tuesdays, but again, I'm open to both days based on what admin wants.
Yeah, and I just wanted to jump in here. We're comfortable with both Tuesdays or Wednesdays. And so we really wanted it to be a collaborative way. And so again, Tuesdays are fine as well.
Any other questions or recommendations? I just wanted to note too that the sheet we have in front of us, this change when we decide what it is would take place starting in August. So next week, our meeting will of course be on a Thursday, but just wanted to clarify that we are looking to transition into a new schedule as early as the start of the new school year. I would like to hear the pros and cons for each, but my preference would definitely be Tuesday. So just wanted to share that.
I am fine with whatever you all choose, whatever is most beneficial to the board who will be here for the next 4 years, as well as staff who are affected.
For Tuesday, can we look at doing it in earlier, or are we standing firm on the 6:15 time? Again, I don't know what the rush is like from when school gets out of session for cabinet and then running through a 5:15 meeting, or if 6:15 is more ideal.
Board Member Carrillo, I think we're in a spot right now where we can see what an earlier meeting would do for us. And, I've done it both ways. I've done it at a 5 o'clock meeting, and I've done even later meetings. And I find, like you're mentioning, that having it a little earlier, just our focus, if we're able to make it on time and are not feeling rushed based on schedule, our focus tends to be just a little higher as the night goes by. With the longer days that we've all had, then, we just run that risk. But I think part of my inquiry is, I think we can consider both. I was trying to look at the agenda item to see if it's specific to just one. But I'm thinking we can consider both on a legal basis.
What do other board members think about a 5:15 time?
I know in the past, when we had an earlier time frame, it was difficult for individuals to arrive on time, but I would defer to your preferences.
My concern begins to think about participants. I know we don't have the highest participation historically, but I do hope that changes in the future, and want to be mindful of making our board meetings accessible for parents to get home from work. Personally, I used to not even get off work until 5:30, so getting here by 6 was hard because of the 7th Street left turn lane. But with the pandemic, I was able to work from home, so that's no longer a big concern, but that's just me personally. I don't know about anyone else's schedule. So those are the first two things that come to mind, is just making sure we're accessible. But if it is more convenient, I'm definitely open to it.
I do wonder if we have mitigated some of the accessibility by providing a virtual option and by allowing families to send in an email with their comments. And then you can also watch the board meeting. They're now recorded, so you can watch it the next day. And then I also wonder if for staff to come to the meeting at 5:15, I wonder if that's almost better, because we know that our staff live in all different areas, and they get out of school at 3:30, 4, somewhere between 3 and 4-ish, I think, with our dismissal times. But I also know that, we still have peer program and parents meeting and principals meeting. So I guess I would wonder what our cabinet's experience is with staff, and whether that would be a 5:15 timing would be a problem. As far as the date goes, I am fine with Tuesday.
I'll address the cabinet administrator question. We haven't formally asked our administrators, but so again, I'm going to come from my own experience. As it was mentioned earlier, sometimes for me as a principal, it was easier to stick around about 30, 40 minutes and then go to a board meeting than need to make other arrangements and have a gap of 2 hours and a chunk. Then it would just become a little harder. But again, I'm only speaking from personal experience. Maybe we have another cabinet member that has touched upon this topic, and I can certainly give the floor to them if that is the case. I'm peeking and I'm not seeing, so.
It looks like they have no comment.
Okay.
And I just want to add to the 5 o'clock start time that sometimes we have study sessions. So just be mindful that if we have those study sessions or executive sessions that we need to do, then that means we'll have to be here even earlier. So I just want to make sure everybody's okay with that. I know we don't have them quite often, but it's also something just to consider, which I'm okay with. The 5 o'clock, 5:15, is that the time you want? 5:15?
I'm surprised we don't have more comments on it, so I'm glad it's I guess workable, flexible, I guess for that. Those are the moments I'm appreciative of the pandemic. Definitely making us have our meetings streamlined. So I'm trying to call, of course, Mr. Thomas to see if we can adjust the wording. To revise the date and the time, but it literally says dates only in our action item. So maybe we could just do the dates today and then address the time frame at a later date. What do you recommend?
Yes, I'm thinking if we amend the option to include the time, we may be able to do that. But I'm comfortable bringing the time back in the same, similar way that we did it right now on even if we can get our documentation ready for the 21st, that way we stay squeaky clean.
I like that idea a lot. That way it does it's fluid, Mr. Thomas can let us know. It'll be a learning moment, but with that, any further discussion? All right, well, let's move forward with a motion then to at least take care of this item. Do we have a motion to take action on our board meeting dates to move them to Tuesday evenings beginning in August?
Jessica Bueno, so moved.
Thank you.
Roger Carrillo, second.
Thank you very much. Any further discussion? Hearing none, may we please have a roll call vote, Ms. Miriam?
Carmen Trujillo,
Aye.
Jessica Bueno,
Yes.
Reggie Carrillo,
Aye.
Alicia Vink,
Aye.
Laura Diaz.
Aye.
Great. With that, all 5 in favor, our motion passes and we will begin in August having Tuesday meetings. Thank you all very much. Yes, absolutely. Okay, we'll move on to future agenda items. Do we have any? Our wonderful board. I don't have any to start off with.
I have 2, I think. The first one is for a study session regarding our exceptional student services. I just feel like I don't know as much as I should, so all the information in like a short amount of time would be great. And then a request for information regarding what type of after-school programming either we as a district provide or is provided in the community for students in self-contained classrooms. Oh, and then I guess I have one more. The last one is receive, discuss, and take possible action to create policy that increases our plant-based meal options and prioritizes local food sources.
Thank you, Dr. Vink. I think that's a great idea for our district, in term, especially as we work to be more environmentally sustainable. For a future agenda item, well, I'll leave it to cabinet to decide if this is a work study session, a future agenda item, seeing as we just passed our budget, our board update, but just due to the budget that was passed, I'd like us to just take a further exploration at the possibility of seeing how that can impact our staff salaries across the board. I know that Tempe has provided raises for their staff because of the budget, but I also know that we're not in the same situation financially, and I trust our district financial leadership, Quintana, Damon, and everyone else to see if we can also, if we're also in a comparable situation, to provide that for our staff. Because I know this budget was passed, but there still hangs the AEL. And so I don't know if we'd be jumping the gun, but I'd just like us to look at that to see if we can, if that positively impact our staff.
Thank you both very much. Are there any other future agenda items I might be interrupting? Hearing none, let's see, we can move on to our final item, J1, and adjourn this evening. Do we have a motion to adjourn our meeting this evening at 7:42?
Jessica Bueno, so moved.
Thank you.
Reggie Carrillo, I second.
Thank you very much. Ms. Mayor, may we please have a roll call vote?
Carmen Trujillo,
Aye.
Jessica Bueno,
Aye.
Reggie Carrillo,
Aye.
Alicia Vink,
Aye.
Laura Diaz.
Aye.
With all in favor, our motion does pass and we will adjourn at 7:42. Thank you all for a great successful meeting under our new leadership. Our next meeting will be next Thursday at 6:15, July 21st. Oh, tell Teddy we said hi when he wakes up, Dr. Diaz.
I know. He's so precious.
Isn't he?
I want to hug him. I need me a teddy. He's like, I'm trying to sleep, lady.
Right. All right. Thank you all very much for your participation.
Thank you.
Have a wonderful evening and drive safe, everyone. We'll see everyone soon.
Thank you.
Good night.
Then we wait, how do we do